Hi, this is Andy Ritchie, and I'm going to give you a brief overview of how the Novum IQ syringe pump will be used in the NICU care area. Keep in mind that the NICU practice is similar to the PICU practice when the patient is very small, like a neonatal patient. A patient who has been home, who has been admitted to the hospital, who is even small enough to go to the NICU would never be admitted to the NICU. They would be admitted to the PICU care area. So the practices that I'm going to show you regarding the NICU care area could apply to PICU as well. So for the NICU, what you'll see is continuous infusions are often used, and those are for your critical drips like dopamine, dobutamine, some of your other therapeutics, fentanyl, Versed, those kinds of things. Also used to deliver antibiotics. Volume over time infusions would consist of things like blood products, PRBCs, platelets, those kinds of things. And then enteral infusions or enteral feedings can also be delivered in the NICU using a syringe pump. Now, keep in mind that's different because in the PICU, they will also deliver enteral infusions, but if the volume is large enough, they'll use something like a kangaroo pump for that feeding. So remember, this is for very small patients. Just as a comparison, you will also see LVPs in the NICU care area, primarily to deliver parenteral infusions and fluids. So TPN and maybe just a normal saline or D5W, something like that. It's also good to note that the Novum IQ LVP is only indicated for parenteral infusions or fluids within the NICU. But our syringe pump is indicated for all of those, as well as the ones I'd mentioned. Key things to know about the NICU care area, what they care about. They're really concerned about high accuracy at very low rates. Remember that our rates can go down to as low as 0.01 up to 1200 mLs per hour, and it is dependent upon the syringe size. A 1 ml syringe could not deliver at 1200 mLs per hour, but a 50 or 60 ml syringe could. On the flip side, a 60 ml syringe could not deliver at 0.01 mLs an hour, but the 1 ml syringe could. We'll discuss later on a new feature that we've added, which is a minimum recommended flow rate per syringe. That is to make sure that the user is utilizing the pump to the best of its ability to deliver at very, very low rates for the syringe which is loaded. Other things that the NICU is concerned about is the ability to deliver very concentrated fluids or medications at very, very low rates because they need to keep the volumes down for those little patients. We want to make sure that we don't fluid overload these patients. When we talk about high accuracy, we talk about doing things like priming to remove the mechanical slack and cinch up the gears. This improves the startup time and reduces the stiction, which is present in all syringes that we load onto any syringe pump. Remember that startup time and stiction have to do with the syringe, not the pump. But the pump does offer the ability to improve that when we use the prime feature. Now, the prime feature is very critical when you're delivering very critical meds at very, very low rates. Because as you can imagine, when you're delivering at 0.1 ml an hour, it would be a long time for that medication to get to the patient if you haven't removed that mechanical slack and cinched up those gears. Okay. Reminder that some patients or some clinicians rather in the NICU care area may use double pumping for the reduction of mechanical slack and to improve that startup time. And as we discussed a while ago in our training, double pumping is getting a second pump started and running for several minutes to even longer, an hour or so, just to make sure that there's a nice continuous flow when they do attach to the patient. Some concerns within the NICU. We talked about stiction, which is common in all syringe pumps. Another thing is vertical displacement. When you are moving a syringe pump around, when you increase the distance between the catheter tip and the pump, raise it up, you could potentially bolus the medication to the patient. And conversely, when you drop it below the patient's IV catheter, you could slow down the infusion. So it's important to point this out to clinicians that whenever they are either moving the patient or moving the syringe pump, they need to clamp the line so that when they're moving the patient around, there's not an issue with either bolusing or causing an interruption in flow because of that movement. We offer loading and bolusing, of course, on our pump, just like on the LVP, and you'll see it used throughout the hospital. But in the NICU, you may see that their practice is to set up a separate pump for a loading dose and or set up a separate pump for a bolus dose. They may not necessarily run it off of the continuous infusion. So just wanted to point that out to you, just in case you come across that. Of course, it's more efficient to set up the loading dose and deliver from the continuous infusion or deliver a bolus dose from the continuous infusion because it goes right back to that continuous infusion.